Hi guys, this is Tara. I wanted to do a video today on blood work in hospice care. So usually we'd get an order for blood work from one of our physicians. We work with, the family and the physician to kind of see when blood work is indicated because it's not something that we typically do in hospice. So some of those situations might be if we want to draw serum albumin for patients on service for, severe protein calorie malnutrition, or we might be determining what antibiotics to use if we suspect they have a blood infection and the family wants treatment for that. So I've arrived with my patient. We'll say his name is John Doe, and I've performed hand hygiene before entering his room. I've verified that this is the right patient. He's alert and oriented, so he could tell me his name and date of birth. And I've verified the correct orders. So what's important there is to make sure I have labels for the tube. I also have a lab slip, and I have checked if the specimen needs to be transported on ice to be delivered to the lab. And what's important to do is make sure that you have a black or blue ink pen to do your labeling, and you might want to have multiple phlebotomy kits with you because you don't always get a good blood draw on the first try. So like I said, I've performed hand hygiene. I'm gonna check out his arm. I seem to like this vein right here because it kind of bounces back at me, and this is a good spot in the anti-cube for blood draws because of how big this vein is. So I'm gonna open up my kit first. This is the vacutainer in there. I have my alcohol swabs, a couple Band-Aids, and some gauze. And I have my tourniquet here too. So before I get everything ready, I want to look at his arm. And when I'm thinking about putting the tourniquet on, I want to poke him here. So I'm going to go about 4 to 6 inches above that area. So a good guide for that is to kind of use your first 4 fingers. So I want to poke here. I'll use my 4 fingers. I'll put the tourniquet there. So I'm going to put my gloves on. I like to stretch these out a little bit because they can be kind of stiff. So I said 4 fingers above this area. That's about right there. I'm gonna lift his arm. And you want it tight enough to have the blood pool in the veins, but you don't want it so tight that it hurts them real bad. So you cross, pull one side over, and just tuck it in the bottom. So while the tourniquet's doing its work, I am going to get my needle ready. Right here. Alright, so I've opened this guy up. He has a little clamp on him. Take that off. And what I want to do is make sure at this point that my gauze is nearby. I have my alcohol pads, and I'm going to unwrap my Band-Aid too, just so we have everything ready. The other thing I want to do is make sure that my test tubes are nearby. So this happens to be a Tiger tube. It's what we had on hand. That's something that we'd use for antibody testing. And it's important too to make sure that you're collecting your specimens in the right order, and I'll attach a chart for that later in the video. So I'm unwrapping my alcohol swab, I'm locating the area, and I'm gonna clean from the inside out, kind of like a cinnamon roll or a pinwheel or something. And I'm gonna let that dry. One, because I'm gonna let it do its work, and two, if it was wet, you're gonna hurt your patient a lot more than you need to. So I'm gonna unwrap my Band-Aid here. I have my needle. Undo the top, and you want to do bevel down. So the pointiest part is going to be flush with the patient's skin. And I like to kind of twist these a little bit. So here's the area, my alcohol's dry. And then I'm going to stabilize the vein and poke. All right, my needle's in. I'm gonna attach this to the vacutainer. My sample's filling. Once you see it gets to the blood flow, kind of seems like it's not really getting any more, you can take that off, undo your tourniquet, put the gauze on, take this out. You want to activate the safety on this thing, so just push it up. All right, thank him for doing such a good job. Take the gauze off, we'll put a Band-Aid on. And there we go.